I have personal testimony of that. My brother had given us all pink eye a couple of years back. He did the traditional route. He did the
Mhm.
antibiotic ointments that his doctor had given, and our family, I did the nanoparticle silver. And I got to say, putting it into our eyes, there's a weight. There's a weight in that water, so you could feel the
Mhm.
heaviness. I can't explain it.
Mhm.
It's just the weirdest thing. You feel the
Mhm.
weight of the water or the silver in your eye, but it worked. We were done within that week, and my brother, who was taking the antibiotic ointment, his came back. You're watching the Dr. Jake podcast. Hi everyone, welcome back. I am Teresa. I'm a mom. I'm a health nut. I'm a wife to a cancer fighter, and today I'm talking with Dr. Jake about antibiotics, about when we need them, when we don't, and what are some really good natural forms that we can take in a lot of situations where we really just don't need the traditional antibiotic. Dr. Jake?
Yeah, so this will be an interesting topic to talk about antibiotics because we're going to dive into when are antibiotics good and when they're not good, and talk about all the natural things that are really great and taking care of killing bugs too.
I'm really interested in this topic as well because I was brought up in the 80s when really we were given antibiotics for it seemed like everything. And
Uh-huh.
to this day, I do struggle with gut issues. I had numerous ear infections growing up. And I remember even my own son, before I even learned about, overprescribing antibiotics, I remember my own son, he was prone to ear infections too. And I think now we read it all down to like food allergies. But I remember his first year, he was on antibiotics like every other month for an ear infection. And
Wow.
it wasn't until about a year in that the doctor was like, if he gets one more ear infection, I'm putting this in his ears. And that's when I'm like, I need to figure out what to do here. And I was figuring out what the root cause of the issues were, so that I didn't need to have him be on these antibiotics
Hmm.
anymore, and be able to actually stop some of the issues that were happening. And I even learned like some of the things that you're going to be talking with us today about, other ways that you can treat ear infections too. So I'm really, this is near and dear to my heart. And I think a lot of people out there are going to they're going to really benefit from this conversation with you. But first, we do want to remind our audience that this is just a podcast, right, Dr. Jake?
Yeah, this is just a podcast. I'm not going to give you any specific treatment advice to tell you how to specifically treat what you're dealing with. So if you have any specific questions, please give my office a call and by visiting integrativemedica.com. Find the phone number there. Give my staff a call and set up a visit with me or some of my other great doctors we have.
Wonderful. Thank you so much, Dr. Jake. Okay, let's just jump into this here. Let's straight up. Are antibiotics overprescribed?
They are absolutely overprescribed. Doctors are prescribing them like candy. And I really thought that doctors were going to stop prescribing them like candy, especially for the kids, because the Pediatric Association, Medical Association, is saying that we need to stop prescribing so many antibiotics. And in many instances, stop prescribing them for like ear infections and things like that. But I talk to my patients and they're telling me their pediatrician is still, whenever they come into the office, they're giving them an antibiotic. So yeah, it's way overprescribed. In most instances, you don't need an antibiotic. The natural antibiotic is going to take care of it. And many times you don't even need anything at all, and your immune system is just going to take care of it. And antibiotics do come along with various side effects. And the big one that don't like out of it all is we're giving it very young, and it's messing up little kids' guts, and then it affects their guts for the rest of their lives.
Yes, because when you're taking an antibiotic, yes, it's killing the bad bacteria that's potentially causing the issue. Sometimes not, and that's why Dr. Jake is talking about sometimes we just don't need it because it's not actually caused by a bacteria, or your body's going to be able to fight it on its own. It doesn't need that extra help. But when you're having that antibiotic kill that bad bacteria, it's also
Mhm.
killing the good bacteria. And more research is coming out that's showing we have bacteria in our gut and we need it. They've been with us for thousands of years. Our whole
Mhm.
systems rely on them for things that we don't even understand. And so
Mhm.
when we're killing that microbiome in our gut, we are wreaking havoc on our entire body. And again, some ways that we know and that research is really coming to recognize and see, but some that we still don't even know because it's a whole universe down there that we're still exploring. So this is a really important topic to be able to know when should you take an antibiotic, when should you not, and I'm eager to hear what Dr. Jake has to say. So he talked about some of the big negative effects, that wreaking our gut. I was reading this too, and some people who might be interested in this topic, maybe they're following some of these gut gurus out there. There's some clickbait, that goes out there too with some of these guys who are working on selling their supplements and things like that. One of the things that I heard, and I really wanted to ask you, is it true that taking one bottle of antibiotics, one session could wreck your gut for over 2 years? That's something that I'm reading.
I haven't read any specific research that concludes that it just taking one antibiotic is going to screw up your gut for 2 years. Now, it is going to destroy a lot of those good bacteria in there, and it depends on how strong that bacteria, that antibiotic is. And maybe it can cause issues for 2 years, but maybe it could even cause problems for the rest of your life because you killed off a lot of your good bacteria in there and you didn't know how to treat it appropriately. But to say specifically 2 years, that's just clickbait because
Okay.
we don't have any specifics there. But yes, I do agree that if you take one antibiotic, you could destroy a lot of your good bugs down there, and then you're going to have a lot of troubles digesting your food. You're going to have troubles decreasing the inflammation in your gut. You're going to have troubles getting nutrients in. Bacteria in our gut do so many different things. So if let's say you have a kid and they took antibiotic for an ear infection, maybe they're going to have digestive issues for a really long time. You need to go to the right doctor that knows how to heal it up after antibiotic. Don't think it's the, oh, I took an antibiotic, I'm screwed for the rest of my life. That is definitely not true. You just got to go to the right doctor that knows how to heal up the gut and give you the appropriate probiotics and things like that, so you're able to get that gut back on track.
And I'm kind of thinking more of myself when I was growing up. It's not just one thing of antibiotics. It was countless,
Yeah.
countless.
Hmm.
I
Yeah.
mean, my entire childhood, I think at least a few times a year, I was on some sort of antibiotic. And I would say that continued through my teens and into my early 20s
Yeah.
before I started to learn, whoa, maybe I don't need this as much. Maybe there's other things that are going on that I can address. And so for that, I know because of my chronic use of antibiotics, when I've had my, certain labs taken to measure the abundance and the variety of bacteria in my gut, that I've gotten horrible scores, horrible scores. So for me, I'm constantly in this state of trying to improve my gut health. So for those of you who had the same experience, you grew up on a lot of it. This is definitely something to think about. And there's things that you can do to heal. And Dr. Jake, I know you're going to talk about, how we can heal our gut from antibiotics if we have to have them, right? If we had to have
Hmm.
them, there's situations where we need to, what can we do afterward to kind of get our bodies back on track? So before we do that, let's dive into, when is it appropriate to have to take antibiotics?
So typically, I like to prescribe a antibiotic like penicillin for someone that they do have strep throat. I am not a fan of prescribing it every month, though. I have some of my patients that come into me and telling me my kid is getting strep throat like every 1 or 2 months, and they're getting on penicillin. Obviously, that penicillin is not doing the trick. But in many instances, you could take penicillin and it takes care of it really quick, and it's been working for decades. So, and we don't want to do something that's not very effective against strep throat because it could lead to heart issues, kidney issues, rheumatoid arthritis, things like that that can happen from strep throat. So I usually like to use an antibiotic for that. But whenever I do prescribe an antibiotic, I'm making sure I'm healing up the gut. I'm making sure they're getting a good quality probiotic that has at least 30 billion probiotic bugs in there, and I'm doing other things to help heal up the gut, like glutamine, zinc, carnosine, N-acetylglucosamine, quercetin, things like that, to get the gut healed up when they are doing something like that. So, but I usually do penicillin for that. Let's say someone is undergoing a pretty intensive surgery and there's big infection risk. I do say it's probably a good idea to take an antibiotic because you don't want to have a chronic rampant infection right into your body and for it to get into your bloodstream. That's really bad news. But again, you could go to a doctor that knows how to heal yourself up before and after and really not have any really bad detriments from taking the antibiotics. Sometimes I use antibiotics for people that have these bad chronic infections. Most of the time, I don't need to prescribe antibiotics in this scenario. I'm able to do it in a more natural means, but sometimes I do it in those scenarios also.
One of the things that happened that I've seen a lot is Lyme disease. And I know that
Mhm.
the effects of Lyme disease can go on, for years if not treated appropriately. But if someone does catch it, They catch Lyme disease early on. Do they take would antibiotics be the best approach to dealing with that?
Yeah, I am a fan of taking the antibiotic. Doxycycline is what you take for about 21 days. I would take it probably maybe sometimes a little bit longer than that. If you do get Lyme and you do actually have the rash, you definitely want to be taking the antibiotic because that's going to help it from becoming chronic or causing really big issues. So I am a fan in that situation too.
One of the other things that I thought was interesting was that here we know that antibiotics wreck our gut, but there actually is a gut condition that antibiotics are often treats, and that's SIBO. Do you prescribe antibiotics for SIBO, and why is that different than like regular gut health?
Interesting thing is I do prescribe antibiotics for SIBO, but it's a specific antibiotic. And sometimes SIBO can be potentially caused by antibiotic. So it's a very interesting thing. But with SIBO, small intestinal bacterial overgrowth is when there's an overgrowth of these bad bugs that aren't supposed to be there. It almost always shows up because you don't have enough good bacteria that is hanging out there. So you're eating food, you're putting your hands in your mouth, whatever, you're getting bacteria in there. And then it goes and plants itself in the small intestine where it's not supposed to be. Any bacteria is supposed to be in our large intestine. Like our good bugs are supposed to be on our large intestine, they're not supposed to be in the small intestine. So they start hanging out there and they start wreaking havoc and start causing inflammation, damage, etc. But yeah, we prescribe an antibiotic to treat it that specifically is for that specific bug. And many times it's very gentle against other bugs too. So rifaximin or Xifaxane is a great antibiotic for SIBO. I almost always do prescribe this for my patients. I prescribe other natural herbal products too to help take care of that.
What about bladder infections?
Yeah, so in many instances, you do not have to take an antibiotic for bladder infections. This many times this is going to respond really well to several different products like Uberci or D-mannose or even berberine, or you could do cranberry juice, not the really sugary one, cranberry juice, and that usually clears it. But sometimes I could give all kinds of natural agents, and it doesn't tend to really clear it for some reason. That's when I go and I do prescribe an antibiotic in that case and find out exactly what antibiotic is effective against that urinary tract infection.
So, any situations, you've had a chronic infection like Lyme disease, you've got strep throat, you just had surgery, you've got a bladder infection that wasn't responding, and antibiotics is what you're going to need to do. It's an amazing discovery. It's helped us with so many things. Obviously, we've had some issues with it being overprescribed. There is some negative effects. It does affect our gut. What can one do after they've taken or during a round of antibiotics to help their bodies recover and not, have the havoc wreaked on them from
Yeah,
that bottle?
so the main thing that you want to do is you want to make sure you get a probiotic. You want to make sure you have a good quality probiotic. I would say majority of the products that are on the market, like 95% of them, are not good quality, and they're not doing much. They might be only 5 billion. That's not enough, or they're giving you poor quality probiotics that are dead and they're not alive. So you want to make sure you get a good quality probiotic and you're taking it in between the dose of the antibiotic. Like let's say you take antibiotic in the morning and you take antibiotic at night. You want to be taking the probiotic like in the afternoon. So you're taking it apart from taking the antibiotic. Also, you want to be taking some things that will heal up the gut because the antibiotic is going to be damaging the gut lining, causing inflammation, and you want to start healing it up during that process. So I like to do glutamine or slippery elm or marshmallow root. These are all things that help soothe the gut while we're eliminating when we're using the antibiotic and we're damaging our gut.
So you had mentioned 5 billion not being enough. How many
No,
billion strains should we be looking for on the bottles?
at least 30 billion. Sometimes I go up to 60 billion many times if they are taking a antibiotic because I really want to get a good amount of bugs in there. Because some of these probiotics are going to be getting killed by the antibiotics. So we want to really get a really high dose, 60 billion. And how you really know if it's a good quality product is it needs to be refrigerated. Not all products have to be. I have third-party tested products in my office that aren't absolutely, but if you're just getting a product off the shelf, you want to make sure it's refrigerated and you want to make sure it has certain numbers behind it. That makes it quality trolls are happening. So it makes me more confident that it's a good probiotic.
So to clarify, there are shelf stable probiotics out
Yeah.
there. But these ones are they're going to be there's certain ones that are the good ones, and the doctors are the ones who know and they have access to that. But if
Mhm.
you're just going to the grocery store, you're just going to the drugstore and you're looking for it yourself, the shelf ones there are not going to be the ones that you want. So stick to the
Mhm.
refrigerated ones. That's going to be the better quality unless you're working with a doctor like Dr. Jake who can, who can give you some shelf stable ones that he knows and trusts for you to be able to, for you to be able to use. Okay, so moving forward then, we restore our gut. How long should one expect? Like if you took a round of antibiotics, how long should you probably stay on probiotics to balance yourself out?
So a typical dose of an antibiotic is probably 7 to 14 days. So you want to be on a probiotic for at least 2 months. So
Okay.
during and then you take it afterwards too.
And then I
And
want to,
afterwards, you don't have to take as high of a dose.
okay.
Like 60 billion, you'll be taking during, and then after you'd be like 30 billion.
To reduce, but no less than 30 billion then.
Nope. Mm-mm.
And then what about strains? Like I see at the grocery store, it's like, but if you look at the ingredient of cultural oil, it's just acidophilus. That's it. How many strains should they be getting in a probiotic to make sure that they're getting a good balance?
So the research is very new on probiotics. So typically what I do for my patients is I want to make it have about at least 4 or 5 different strains in there of lactobacillus and bifidobacterium. And the lactobacillus, there's several different forms like lactobacillus alphadophilus, lactobacillus rhamnosus, etc. So you want to get several different forms in there. And when I do prescribe probiotics, I like to
Wonderful.
vary it and get several different forms.
So my next question would be, given that probiotics are an actual bug, like they're
Hmm.
they're bacteria, right? That they're living. They need to eat, right?
Yeah.
I get concerned about people who take probiotics, but then don't eat the foods that their probiotics would eat, and then they're just wasting their money because these bacteria are going in their gut and then dying because they have nothing to eat. What are some foods that they can eat that have that prebiotic fibers and so forth that bacteria really strives on?
So sometimes you could get a probiotic that has prebiotic in it, so that helps bypass some of the effects there. But you can eat certain foods. Really, it's fibers. So soluble fibers is what the probiotics are going to be eating on. So that's vegetables, fruits, grains, things like that are what they're going to be feeding on. A lot of times they really like fruit. Fructooligosaccharides is what they really love to feed on, and that comes a lot in fruits.
So good to know. So making sure that you do, eat the right food so that they can live and multiply and all the things that we want are very important. Okay. All the other conditions. There's so many things out there that we get prescribed probiotics for. Let's talk about those. What are some conditions that you actually say, you know what, we don't need probiotics. There's other alternatives that we can do to get rid of these issues.
Yeah, so really, in majority of cases, I don't prescribe antibiotics, and it's really not needed. So let's say someone comes in with a sinus infection. If it's acute sinus infection, in reality, usually that's a virus, anyways. But sometimes it's a antibiotics. So for like a chronic, let's say they have acute sinus infection, I many times prescribe like a nanoparticle spray. Tends to be really good. We also could do a neti pot, and you could put some berberine powder in there. That could be really effective. Also, you could put some silver in there for that. If you come into my office, something that's really great is like a ozone insufflation in the sinuses. That is the best treatment I have because it's able to go really into everywhere because it's a gas and it's able to get in there and really kill off all those bugs. Some other conditions is like, let's say they have a bacterial pneumonia. Now, sometimes a bacterial pneumonia can get really bad and we do need an antibiotic in, but in majority of cases, I could take care of this really well with several different herbs like berberine or garlic or silver, or you can nebulize hydrogen peroxide. Make sure you go to a doctor that knows exactly how to do that. Don't just start nebulizing hydrogen peroxide. Or you can nebulize silver, or all kinds of things that you could do for that condition. Skin conditions, let's say like you have staph infection, that many times could be taken care of with like a essential oil topical with like thyme or eucalyptus or oregano oil and things like that. Make sure you dilute those oils because they will cause irritation. And then there's various other bugs that are out there that could, let's say like a eye infection even. Let's say you have a bacterial eye infection, peak eye. Many times what I really like that is And nanoparticle silver works awesome for pink eye, and you could put that right into the eye, and it clears it up.
I have a personal testimony of that. My brother had given us all pink eye a couple of years back. He did the traditional route. He did the
Hmm.
antibiotic ointments that his doctor had given, and our family, I did the nanoparticle silver. And I got to say, putting it into our eyes, there's a weight. There's a weight in that water, so you could feel the
Hmm.
heaviness. I can't explain it.
Hmm.
It's just the weirdest thing. You feel
Hmm.
the weight of the water or the silver in your eye, but it worked. We were done within that week, and my brother, who was taking the antibiotic ointment, his came back. So I'm a
Hmm.
big believer on that silver, and I love that silver, that same nanoparticle silvers for. I used to be prone to sinus infections as well. And by the way, I'd like to make a side note: if you're prone to sinus infections, really look at food allergies because there's
Yeah.
got to be a reason why you're getting them. And for me, food allergies was huge on that. But when
Okay.
I do feel like one's coming on, you could get the nano the drops that you could put in your mouth. You can get it in a nasal spray that you just spray up into your nose. And then yeah, the drops I just were the ones we put in our eyes. But I know Dr. Jake, you specified nano as a very important differentiator when it comes to what kind of silver they should be getting. Is there a reason for that? I imagine there is.
Yeah, so nanoparticle is going to be much easier to be eliminate from your body. So if you look under a microscope and you look at other silvers that aren't nanoparticle, you're going to see these little slivers of silver in there. And these little slivers of silver can potentially implant themselves in your tissues and maybe make you gray if you take a lot of it. And it's not going to be as potent because not as much of it's going to be absorbed. But when you do it nanoparticle, it's been made in such a way that each silver is this little baby particle. So it's able to go into the body and eliminate very well, kill off the bug and get out of the body really quick. So I want to make sure people get nanoparticle. That's my favorite form. People make homemade silver. It's typically not nanoparticle if it's made that way. And that could potentially cause harm if you don't do it right.
Thank you for that. Okay, I know my story with ear infections was one of the reasons why I was really eager to hear what you had to say. And I know that I've learned a lot in my own journey for ear infections. We see a lot of it in our kids. Our doctors are real prone to just hand out those antibiotics like candy. It's wrecking our kids' guts. It's not helping. They're still getting them over and over and over again sometimes with some of them. What can we do if we have an ear infection or our kids have an ear infection so we
Yeah.
don't have to resort to the antibiotics?
Yeah, so probably the most common thing that kids get antibiotics for is an ear infection. And I have never, in the whole time of my practice, ever had to prescribe an antibiotic for an ear infection. It's taken care of really well with just doing like a garlic mullein drop into the ears. And you do it like 3 or 5 times a day, and you do it for like 3 days, and it clears it up. Now, if it's not clearing up, go to a doctor that knows what they're doing and they could give you some other options. But it's very rare that you're going to need an antibiotic for this. Garlic works really well and clears it really well. I have 5 kids, and none of my kids have ever taken an antibiotic for an ear infection.
Now, some kids are more prone to them. I know that my son was getting them all the time, and so he
Yeah.
was just on antibiotics all the time. And so I also imagine, like, okay, so we want to address the ear infection itself, garlic oil and some of these things, but also addressing like what if your kid is getting them all the time, like getting to that root cause and figuring it out. And I imagine there's differences, food allergies and so forth. For my son, changed everything for him. I mean, he was getting them every other month. And again, I got down to the point where the doctor was like, I'm going to put tubes in his ears if we don't solve this. And I started doing my research, and he's a C-section baby. And I was reading up that C-section babies could have, because they're yanked in such a way out of the womb that they could have some damage to their atlas on their neck. And so I thought, and that could cause pressure and things like that. So I tried it out, and I took him to a chiropractor, and the ear infections stopped. I had him go once a month,
Great.
and he never got an ear infection again. It was
Awesome.
amazing. Absolutely amazing. Now, that might not be the case for everyone, right, Dr. Jake? I imagine
Mhm.
for some people it might be a different cause.
Yeah, I mean, there's several different potential causes. Probably the most common one I see is food allergies, or kids are just pounding the sugar all the time and they're prone to that, or they're taking antibiotics, destroy their guts, and they're eating tons of sugar, and then they're just going to get ear infections all the time. But yeah, ear infections can be related to malalignment of the bones throughout your body, especially in the neck. So I think that's a great thing. Also, it could be sometimes related to Your cranial bones could be malaligned too, and cranial sacral could be really good for that situation, for ear infections potentially too, if they keep on getting them.
So if you're prone to infection and you keep getting them, get to that root cause. I would even say for the last one here, you'd brought up bladder infections. If you're prone to bladder
Yeah.
infections, cause. But if you have one, what can they take, Dr. Jake?
Yeah, so if you're getting UTIs all the time, it's again like getting ear infections all the time. You need to find out what the cause is. And again, many times it can be related to food allergies, gut issues, imbalance of good bacteria, etc. But what we can take naturally for bladder infections is we could take something called Uber berry. This is a really good herb that works really well on taking care of that. You could do D-mannose. It's a certain sugar that binds to the bacteria in the bladder and helps pull it out. You could do cranberry juice, which can be really great. I like to do the pure cranberry juice. Even what's interesting, I was reading a study on just ocean spray cranberry juice, and they showed that it was beneficial for urinary tract infections. But I like to do the real stuff. You do about a half cup 2 or 3 times a day. And usually that protocol is able to take care of it. If that doesn't take care of it, I do some other herbs like garlic and berberine and oregano oil and other things that can tend to be really good for that. Sometimes I do certain IVs if needed for this. And if needed, sometimes I go with the antibiotic. That's rare though. I usually don't have to go that route.
It's good to know. Okay, so you covered a lot of different common conditions that we often resort to antibiotics for, but are not necessary. And for each one, you gave a blend of possibilities of things that you can take. In the end, I kind of looked at it and I thought, okay, we're really down to herbs, certain herbs, and silvers. So as if you were to if someone were to have a medicine cabinet stocked to take care of their family, take care of themselves in case these things come up, based on what you talked about above, what would be some herbs that one would want to keep in their medicine cabinet?
So I like to have a nanoparticle silver because it kills off all kinds of different bugs. So I really like that. I like to have a garlic mullein drop. So if your kid gets an ear infection, it could take care of that. We're talking about antibiotics, but we're treating illness in general. I like to have elderberry syrup is a really important thing because a lot of viruses come on board, and elderberry syrup's really great on taking care of that stuff. You could get some essential oils like thyme, eucalyptus that you could do like a steam inhalation for. So if you have a sinus, like if you get a sinus bug or you get a bug in your lungs, it can be really good at taking care of that. And then I like nutrients like vitamin C, zinc, vitamin A, vitamin D, especially you've got to keep your kids' vitamin D up. These are all things I usually have on hand all the time for when kids or you get sick.
And then you had also mentioned, so we got a bunch of these herbal oils, these essential oils in there, and there were a couple of other ones that you had mentioned that I think fit into that herbal spectrum. Right? Was the berberine,
Mhm.
D-mannose, uva ursi? Are these things that are in powder form? Are they in capsules? How typically do you have anybody take
So,
those?
so many of these can be in capsule form, powder form, tincture form. So you can take them in several different ways. Berberine, I usually do in a capsule because it's really bitter. Uversi, usually I do in a tincture. It's a really good, easy way to do that. That's a herb preserved in some alcohol. But yeah, and then thyme and eucalyptus is an essential oil form. Now you can take these as an herb, but let's say if you're doing a steam inhalation, it's going to be through the essential oil form. Or if you're putting it topically on skin, it's usually essential oil form. But if you're taking it internally, don't take essential oil form. You're going to take the herbal form that usually comes in a capsule or a tincture.
Right. And then just to explain that to our audience, essential oil has been like it's super, super, super
Yeah.
concentrated. And you might think, oh, it's natural. So that means it's great and I can take as much as I want or whatever. But our tissues inside our body are very sensitive and some of these are very potent and they actually could damage if you ingest it or bring it into your body. So that's why you want to be very careful with essential correctly. Oftentimes they need to be diluted with oils and only small amounts that are really needed to make some of those impacts. So definitely
Mhm.
talk with your doctor about how you can properly use these so that you don't hurt yourself, right? So
Yeah.
if somebody were to want to talk to you, they want to start using some of this stuff, they want to make sure that they're doing it right. Maybe they're dealing with some chronic infections. How could they get a hold of you?
So yeah, so if you have any questions or you want a specific treatment plan for whatever you're dealing with, visit our website, integrativemedica.com, find our phone number there, and set up a visit with a virtual or in-person visit with my receptionist, and we'll get going.
Perfect. All right. Thank you so much, Dr. Jake, for this awesome interview on antibiotics and natural forms. And for everyone else, we'll see you guys next week.
Hey, Dr. Jake, thank you for your time today. And if you enjoyed the show, then do us a favor and leave a review. It helps more people to find the show, which could save their life. And remember, this is a podcast and should not replace personalized attention from a medical professional like Dr. Jake. If you or someone you know has been diagnosed with an autoimmune disorder, cancer of any stage, or a life-changing illness, visit our website today and schedule a virtual appointment with one of our doctors who can lead you to a treatment plan in your area. That's integrativemedica.com. Integrative, Medica.com.
Thank you for listening to the Integrative Medica podcast with Dr. Jake. To hear past episodes and get alerts for the future, subscribe to us on your favorite podcasting platform and be sure to follow us on YouTube as well. Just search for Integrative Medica with Dr. Jake.